Okay. Hello, today I have one patient here who suffered from a fall while mountain climbing, rock climbing, and has is bleeding from the back of his neck and suffered trauma and is unconscious. So let me get it going. Yeah, all my PPE on and the environment and scene is safe. However, there are loose rocks here just to keep in mind. And the patient is unconscious, so I'm gonna gather information from the crowd that was around, and the mechanism of injury here was that the patient was rock climbing and fell down and hit the back of his head uh, on the rock, and they noticed that the patient fell toward, leaned more towards his right side when he fell, so to keep an eye out on that. And this is my only patient, and I do not need additional resources. Only have one patient, and I have everything I need with me. But I may need some spinal stabilization here. Okay, so general impression of the patient here is a mid-20-year-old male who bleeding and suffering from trauma in the back of his head. So the patient is unalert and unresponsive and painfully unresponsive. So I'm going to make this a stat patient for sure. This is going to be an emergency here. So let me begin to examine the patient's body. Let me check the pulse here. Okay, so the patient does have a pulse and it is normal. Let me check the patient's skin here. Okay, the patient's skin is pink, warm, and dry. Let me examine the patient to see if I see any blood coming out. I see blood from the back of his head. I'm examining the rest of the body. I see no blood, and I did keep in mind about the right side of the patient, but there's blood from the back of his head. Let me clean that up. All ready to go. Okay, so that's all done with, and let me position the body to get in place. Okay, so I'm gonna be checking the patient's blood pressure, pulse, respiratory rate, and all that. Okay, good. And the patient's chest is rising up and down, so the patient does have a clear airway and is ready to go. But now I'm going to examine the body from head to toe, starting from the head. It's still bleeding, and the head, I can feel there's somewhat of a hole from the injury here. The neck, checking the chest. All good. Now moving down to the pelvis. All good. Did feel a little bit of tenderness on the right side. Going on to lower down. Now to the buttocks. All good. And I was going to attempt to take the sample, but since the patient is unresponsive, I'm not able to. So I'm going to move on and transport this patient and make this a full-on emergency stat since the patient is unresponsive and had a head injury. Thank you.